So the microbiome carries out so many functions that promote health and help us to prevent chronic disease. It's estimated that about 60 to 70% of immune function actually takes place in the gut, and the microbiome actually supports that immune function by creating a protective lining within the intestinal wall to protect against those harmful bacteria. The microbiome also biochemically sends signals to the immune system, to immune cells, to help the immune system target the right bacteria. So those opportunistic bacteria to protect against the harmful bugs in our gut. The microbiome aids in digestion by producing certain enzymes. These enzymes help us to break down certain foods. So without these enzymes, adequate digestion just does not take place. The microbiome helps to produce certain key vitamins, specifically vitamin B12, which we cannot produce on our own. But the microbiome is also integral in helping us to produce other B vitamins, vitamin K, just to name a few. The microbiome helps to produce short chain fatty acids. So these short chain fatty acids help to promote the acidic environment that beneficial flora actually thrive in. But further, short chain fatty acids as well help us to control lipids, triglycerides, the LDL or the bad cholesterol. So there's a certain heart health benefit that we get from these short chain fatty acids. The microbiome also plays a role in controlling hunger by helping to signal satiety. And further, the microbiome plays an integral role in the production of serotonin. So serotonin is important for mood, for getting adequate sleep. So this is an important neurotransmitter that the microbiome helps to produce. Serotonin, interestingly enough, plays a key role in digestion. So again, the microbiome does so many different things for us to keep us healthy and to help us avoid chronic conditions. Because of all the beneficial functions that the human microbiome carries out, if dysbiosis does occur, there are many, many links to chronic conditions. Certainly, conditions of the GI tract, whether that's IBD, Crohn's disease, ulcerative colitis, are all quite possible. You can also link in various forms of colon cancer as well. Obesity, there's a clear link between dysbiosis and obesity. Celiac disease, type 2 diabetes, heart disease, depression and anxiety, rheumatoid arthritis, and other immune related conditions, cancer, kidney disease. And this is really just scratching the surface. So this next segment is called Fun with Fecal Samples. So what studying poo has taught us about links between the microbiome and chronic disease. So researchers have been able to study fecal samples and be able to make certain inferences about given samples. So if you look at fecal samples from individuals that have a variety of GI ailments, what you tend to also see is a very poor diversity of microbia, and especially the beneficial flora. You can also look at individuals that have some of these chronic conditions, whether it's diabetes or heart disease or various forms of cancer. You can look at individuals' fecal samples and be able to, again, see issues with the health of the microbiome coming from those individuals that have those conditions. One study in particular looked at fecal samples from identical twins, one twin who was obese and one who was of healthy weight. One key factor that was noted within the fecal samples from these two individuals was the individual that was obese, again, had very poor microbiotic diversity within the microbiome and low levels of those beneficial flora. So there's a lot of interesting inferences that are being made now with respect to these samples and how there is quite a bit of linking between these chronic conditions that exist and the relative health of the microbiome. So, what are the key lifestyle factors that impact the health of the microbiome? Well, there are quite a few different lifestyle factors that do impact the health of the microbiome. We'll kind of focus on these four key areas: diet and human nutrition, medications and how those impact the microbiome, exercise and physical activity, and stress management. So we'll kind of break down each one of these different categories. Beneficial flora and diet. So, the best advice that can really be given regarding a healthy microbiome and eating would be to follow a whole plant-based foods type diet, consuming as many whole plant foods as you can. Things, of course, basic fruits and vegetables, legumes, whole grains, nuts, and seeds. Beneficial flora feed on the fiber, in particular soluble fibers, and resistant starches and short sugar chains that are present in whole plant foods, and many different plant foods are good sources of these soluble fibers. Things as simple as whole grains, oatmeal, for instance, apples, avocados. Beans are probably one of the best sources of these soluble fibers and resistant starches. Avocados, I believe I may have mentioned already. But most whole, unrefined plant foods have some degree of what is called a prebiotic. So these are those smaller food compounds that beneficial flora do feed on. So again, if you're looking to support a healthy gut and beneficial flora, eating plenty of these prebiotics, which really are whole plant foods, is really the best way to go from a diet standpoint. And remember, as these healthy flora are feeding on these prebiotics, they're producing these short chain fatty acids, which again helps to stimulate the right environment within your GI tract to continue to help support the beneficial flora, and really helps to tampen down the negative or opportunistic flora, because they don't live they don't live well in an acidic environment. So we just talked about prebiotic foods. Now we'll touch on probiotic foods. So these foods actually contain live bacterial cultures that are beneficial cultures. So certain foods, probably the most approachable ones, are going to be things like maybe yogurt and sauerkraut, pickles. Are some good options. You also have others like tempeh, for instance, which is a fermented soybean product that's used oftentimes as a meat replacement. You'll also have kimchi, which is a spicy Korean side dish. Other folks will use it as a garnishment as well. Miso, which is again is a fermented soybean product. It often comes in a form of a paste, which is used in soups and stews and provides a lot of flavor. Kombucha is very popular right now, which is a fermented tea drink. You'll see a lot of those on the market as well. So all these different foods already contain those live, active, beneficial cultures that your GI and a healthy gut needs. other foods that have been shown to support beneficial flora include a compound known as polyphenols. So these foods include dark chocolate, grapes, blueberries, red wine, green tea, almonds, onions, and broccoli, to name a few. So we've touched on the foods that help to support a healthy microbiome, and now we're going to look at foods that you may want to limit to support a healthy microbiome. Some of these foods are linked to dysbiosis. So red meat and high-fat dairy are two of those items. Not that you can't eat them, but do so in a limited fashion. Limited high-fat foods, fried foods. Artificial sweeteners have come under scrutiny in recent years as well, especially aspartame, Splenda, acesulfame K, and saccharin are the ones that tend to be the most problematic for the microbiome. Limiting high fructose corn syrup is another one to keep an eye on. Of course, high fructose corn syrup is used as a cheap sweetener, and you'll find it in virtually every refined food on the market. So definitely be leery of that. There are a number of studies that show HFCS linked to dysbiosis. Keep an eye on the alcohol consumption. Too much alcohol can certainly negatively impact the microbiome as well. And then if you can look at the standard American diet or the Western pattern diet, which is consuming a lot of refined foods, a lot of high-fat dairy, meat products, and very few whole plant-based foods. If you can look at that as a whole and do your best to avoid that pattern or style of eating, that would certainly serve you well. Medications are another thing that definitely have an impact on the microbiome. So I'll provide a disclaimer here. So certainly any medications that you are taking that you've been prescribed, definitely continue to take those medications as directed by your doctor. But these could be some things to consider as you go forward, possibly having conversations with your physician regarding alternatives or the possibility of eventually getting off some of these medications. The first one, certainly antibiotics are a necessity in certain situations. It's good though to really evaluate each situation on a case-by-case basis and really ask yourself, do I need this antibiotic right now? Antibiotics, of course, will take care of a harmful infection. However, they also kill the beneficial flora in our bodies as well, which allows more of those opportunistic bacteria to kind of populate in their absence, unfortunately. Other medications such as proton pump inhibitors, which help control stomach acid, metformin, which is a very common medication for controlling blood sugar, opioids, antipsychotics, non-steroidal anti-inflammatory drugs for inflammation and such. So all of these above medications are either associated with a reduced diversity of the beneficial flora or growth of harmful flora. So this by no means is an all-inclusive list. This is just a few of the common medications. So the advice here, just be aware of what you're taking and how those things impact the microbiome. And we'll pick up with how stress and exercise impacts the microbiome, and then we will wrap up in part 3.